What do you think the biggest mistake that practices make in presenting treatment?
Presenting too much too soon, not looking at it as a relationship first, looking at it as a exam. Also, almost looking at an exam like an interruption.
It's important that at the beginning of the relationship with the hygienist, Andrea, that the doctor explain to the hygienist what his or her treatment philosophy is.
80% of restorative dentistry is coming from hygiene. Patients come in new. They're at a little bit of an arm's length about who is this, what do I do, are they trying to sell me anything? So they don't necessarily accept everything in the beginning. But over time, with a good relationship, they build trust. And now that trust leads to treatment acceptance of a larger case later. That was the collaboration between the dentist and the hygienist over all those years, how they built that together.
You've heard me on this podcast. We're coming up on over 7 years. A lot of what I learned about dental management, I learned from this nice lady on this podcast.
Internal is the least expensive method to receive new patients, and it has the greatest yield.
Why some dentists consistently achieve high treatment acceptance while others struggle with that?
It's the experience and how the patient feels when they come and go for each visit.
What advice would you give to a new dentist starting a practice today?
Are you a dentist who's striving to build a more thriving, profitable practice without feeling overwhelmed by the numbers? Hey, good news, there is a better way. The Academy of Dental CPA member firms know dentistry. In fact, it's all they do. Our members are experienced CPA firms who specialize exclusively in serving dentists across every stage of ownership. From startups to acquisitions, to optimizing associate income, to advanced tax strategy, practice growth, and transitions, we're here to support your financial success. When you work with an ADCPA member, you get more than a tax preparer. You get a strategic partner, someone who understands dental industry benchmarks, overhead management, collections, dental insurance, compensation models, and all the unique business challenges you face every single day. We bring clarity to the business side of dentistry. While you focus on clinical excellence, we ensure your financial foundation remains strong with advisory that turns data into confident decisions. Join over 11,000 dentists nationwide who have a financial expert in their corner. Visit adcpa.org to find a trusted dental CPA near you. That's adcpa.org, because your numbers should work as hard as you do.
This podcast is sponsored by Bank of America Practice Solutions. When you need financing for your dental practice, you really want to work with someone who fully understands your industry. For over 25 years, Bank of America Practice Solutions has helped dentists across the nation reach their goals through smart financial solutions and expert guidance. Whether you own a practice or are just getting started, Bank of America Practice Solutions can provide customized financial help for your short-term needs and long-term aspirations. Email dg.connect@bofa.com to find expert guidance, personal attention, and real solutions. That's dg.connect@bofa.com. And hello, everyone, and welcome to another edition of the Art of Dental Finance and Management podcast with Art Wiederman, CPA. I'm your host, Art Wiederman. Welcome to my podcast. And I have a very, very special guest, a very, very dear friend that I'm going to introduce you to in a moment. Her name is Andrea Clasen. I've known Andrea for 41 years. I started working with her when we were both at the Pacific Institute of Management. And Andrea is going to share with you her 45-year career as a consultant and all of her reflections and kind of where we've come from starting in the 1980s and coming back here. So this is going to be a great, great podcast. Make sure you listen to the whole thing. Just a couple of things before we get started. First of all, I want to thank my wonderful sponsors, Bank of America Practice Solutions, the Academy of Dental CPAs, and this is the official podcast of the Academy of Dental CPAs, and Interview. Now, I also want you guys to all follow me on social media. We are on Facebook and Instagram. Please follow us. Please like us. Follow us on YouTube and TikTok. And I want to let you know that if you are coming to the National Academy of General Dentistry convention at Caesars Palace in Las Vegas, I will be speaking on June 26th on transitions. I'll be there all day. I hope you'll come and see me. And if you do tell me you're a podcast listener, I had that happen a couple weeks ago when I was in Chicago, a couple weeks ago from when I recorded this. And I had a couple folks come up and say, gee, we've been listening to your podcast. We really, really love it. So with that, let's get to my dear friend, Andrea Clasen. I met Andrea in 1984 when I joined the Pacific Institute of Management. And for you gray hairs like me out there, Dr. Jim Pride and Dr. Phil Whitener hired me to run their financial services division. And there were about 10 to 15 wonderful young women consultants who were all over the country. And Andrea Clasen was one of them. I consider her my big sister in dentistry. And she works out of Southern California. And we're going to talk today about all things that have happened since then. But I will share a story that when I started in dentistry and my wife and I moved our family from Huntington Beach, California, down to Laguna Hills. And that, for those of you who are not in Southern California, that's about a 30-mile hike. So I needed to find a new dentist. And I couldn't think of anybody better to call than Andrea. And I said, Andrea, who do I go to? And without hesitation, she gave me the name of a dentist. And that dentist happened to also be a specialist in sleep apnea. And I truly believe he diagnosed my sleep apnea, which I've talked about many, many times on the podcast. And I'm convinced he saved my life. So, Andrea Clasen, welcome to the Art of Dental Finance and Management podcast. And thank you for, in an indirect way, saving my life.
You're welcome, Art. That's an interesting story. I had forgotten that.
Well, no, you were the one I called and you're the one that referred me. So anyway, so let's get started. What first drew you into dental consulting back in the 1980s?
Well, I don't know if you even know this story, Art, because I started
Find out in a
assisting.
second, right?
Pardon?
We'll find out in a second if I know the story.
I started dental assisting in 1967. So
Oh my gosh.
this is my 60th year working in dentistry. So
Oh
I
my.
had 15 years prior to going to Pride, and I absolutely loved assisting. I just came out of high school, and I've just happened to take a job in a dental office. It started with cleaning the floors and staying in the back and not assisting because the dentist didn't allow me to get close because I didn't know anything. And then I moved on to another wonderful office, and it was from then on I just sort of fell in love with it. So I worked in the back, I was assisting, and then the dentist I worked for told me I could get a $60 a month raise if I went to the front desk. I went
Wow.
to the front desk, and I enjoyed that, but I loved the clinical side the most. But more dollars meant making life a little bit easier. So I took that, and then I went on to work for a prosthodontist, Alex Coper and Gary Harmatz, and it was really through an accountant that worked with those dentists and Gary Harmatz that said, you should look into consulting. So that was the first time I'd even heard about it. And it was a few years later that I was then introduced to the Pride Institute. But it was really through Gary Harmatz. And the
Uh-huh.
people I worked for really encouraged me to look at that. And I loved dentistry so much, I wanted to stay in it. And that's how I got to Pride. And I was with the Pride Institute for 4 years, and then I went on my own.
Yeah, Gary is a dear, dear friend of mine. I
Yeah.
helped him a lot, and he's just one of the most incredible humans you're ever going to meet. I love the guy. And in fact, I don't know if you know this, his wife Susan and I went to the same high school in Brooklyn.
I
James
did
Madison.
not know that.
Well, we're going to learn all kinds. You and I have
What a
known each other
small
40,
world.
41 years, and we're going to learn all kinds of things about this will just be about our no, our
So
personal life, not
I
really,
just
but
grew up in dentistry. I mean, I went from
you
high
did.
school to a dental office and I really haven't looked back. And it was
No.
those people I worked for that really I was, influential in everything I still do today. I mean, it changed my life completely.
So, what do you think has allowed you to stay relevant for 45? I mean, that's a long time, 45 years. What's allowed you to stay relevant in
Well, it's
dentistry?
a surprise to me because I would have thought I would have gone through the whole generation of first clients starting in the 80s with Pride, and those clients I stayed with for 30 years. At the same time I started consulting, I started a study group. That study group, little did I know, was one of the most influential things I've ever done. And that study group, it exists today with a small number of 8 doctors who are getting ready to transition, but in its heyday had 14, and that study group was together 40 years. So I learned a great deal from that group, facilitating and working with them separately. And then I went on to think, well, they have all expressed that the difference that has made in their career and coming together, to talk about life and managing an office. So as they expressed their value and I thought about it, I thought, well, I wonder what it would be like to start a second group. And I did. That group now has 14. We've been together 14 years for the second group, and that's the next generation. So that generation, it just was happenstance because they're like in their 40s now. The senior group is moving on. That group became clients and it gave me a whole new chapter. So I continued consulting because these wonderful people came about. And from the study group to working with them independently, it was like a repeat. And it was just a blessing because I really thought, in fact, my husband gave me a retirement party about 25 years ago.
You retired? No.
And it was fabulous, I must say. I had the ADA president and all sorts of people there. It was an amazing thing at the Ritz-Carlton, a big fancy thing. I think that was a Saturday night, and I think I went back to work on Monday, and that was about 25 years ago. So I really don't know when I'm leaving, Art. I don't. Maybe when you stop, I'll stop.
Well, Andrea, you just have such a passion and a love
I
for what you do and the people that you help. I don't see it because this is what you've always loved.
I don't I've thought about it a great deal because it's a job and I can get very tired. I traveled the country. It's been a lot of work. And then I'll think, that's it. Enough's enough. And I'm 77 now. So, I mean, I suppose I'll just come up in a walker and sit here and we'll have a little podcast. But I,
Well,
I
I
don't
don't
know.
think that's gonna happen, and I will tell you that my oldest doctor that I ever consulted with was a gentleman by the name of Dr. Jacob Eisenreich in Anaheim Hills. He came to my marketing seminar at the age of 92 to learn how to market his practice. He was a Holocaust survivor. He passed away at the age of 95 or 96, so you got a ways to go, young lady, okay?
Well, I'm staying healthy. I'm blessed there. My husband is a physician and he's
Yes.
87, still practicing full time.
Unbelievable. I mean, your husband,
And
Gordon, is just one of the most incredible humans I know.
I just think we love the people we work with. And I could almost get emotional. My clients are very dear and they've given me as much as I've given them.
Well, I'm going to let you give some to thousands of people that listen to this podcast. Let's start talking about dentistry. So, I want to start off by asking you about why some dentists consistently achieve high treatment acceptance while others struggle with that. So, talk to us about treatment acceptance.
I think, it goes back to philosophy because when you talk about the didactics and system of, say, a new patient exam and treatment acceptance, and there is that component, which is very important. But when I really pull back and I look at why is one more successful, it's often that they've implied or spoken to their team about the purpose of that exam or the purpose of treatment acceptance. And for example, the ones most successful look at it like the most important part of this visit's going to be how we build this relationship. It is not, are we going to close the case and get the treatment accepted to do And did we close it? Did we book it? How many dollars are involved? It's how are we going to be successful in reaching this individual, making them feel special and cared about so that they want to come back here. Because if they return, they're going to accept treatment at some point. The
Right.
question is when, and that really doesn't matter because everyone's different. Every single patient should be like a gift, just for curiosity. Who is this person? How can we learn about them, get to know them, and decide what's best for them and when? And we need them to help us with that. So if the mindset of the dentist isn't any pressure, it's really like, let's look at who we're going to get to know today, be successful in this relationship building process, and the rest is going to fall into place. And if the team
Exactly.
has that feeling, then they smile and they're welcoming and they ask questions and they don't feel any pressure, but they're very attentive, very much in the moment to be focused on what the patient has to say and be a good listener. And it's like getting to know someone that you've just met and saying, I really want to learn a little bit about you.
Oh, that's awesome. I'll tell you, Andrea, you know that for the last 20 years, I've sold dental practices. And when we have a closing meeting, I talk to the buyer, and the buyer's never owned a dental practice before. And this is what I say to the buyer. I say, buyer, here is the first thing that you need to say to your new team when you meet them. You say, team, I am honored and humbled to continue the tradition of Dr. Seller. And I want to let you know that everything that we do here in this practice going forward is going to be for the best interest of our patients, regardless of whether we get paid for it or not. And I tell them that if they start with that, then they will be wildly successful. So it's exactly kind of what you're saying.
Absolutely. And that's what was instilled in me. I came in as a teenager in an office and I was all about me. And I was very focused on, what was my day like and my difficulties and struggles or whatever. I came in and a dentist I worked for kind of looked at me and I don't know what his words were. I can't even tell you today. But he implied very clearly, this isn't about you. This is about the person that's sitting in this chair today.
Yes.
And we have to really be there and help them because they're probably nervous, anxious, worried about something. So we have to really shift gears and be here. And that left me with purpose that there was something for me to do that made a difference. And I went back at 5 o'clock to my life. It was still there. But during that time and hours I was there, I was actually able to help someone. And that's what I think changed things for me. I think that's what inspires team members today. Not the dollars, not the production, not the goal, not all that. They want to feel they're next to someone that cares about that individual for the right reasons. And that is so motivating for these ladies and gentlemen that work in an office. Mostly we have ladies, but I find that hygienists and dental assistants, everyone, they all rise to the occasion and feel attached to and the loyalty to the practice when they watch the person they work for just show that care and concern.
Yep.
It,
Absolutely.
and I've thought about this a lot since we scheduled the podcast because I was thinking, what is the difference? And that really is it. In the last couple of offices I was in, it reminded me of it in spades because it was a practice that has quadrupled since I started working with them 15 years ago.
Wow.
And it's clearly the dentist, and that's his only focus is the patient. And all the numbers, everything just multiplied, just automatically, because the team made it happen. And he has the same team. 75% of the team he still has 15 years later.
Yeah. So, Andrea, with that in mind, what do you think the biggest mistake that practices make in presenting treatment? I mean, we've talked about what they should be doing and what the mindset and the culture should be, but what is the biggest mistakes that you see that
Presenting too much too soon.
there you go.
Not looking at it as a relationship first, looking at it as a exam, also almost looking at an exam like an interruption. That's been interesting, you know, because over here we're doing production. We've got quite a good day here. It's a blockbuster day production wise. So we're focused over here. And now there's an exam.
Oh, why? Why are
Okay.
you screwing up my day with an exam?
Then there's the rolling of the eyes or the hesitation to go. And then we have an assistant, seats the patient, takes all these records first. Doctor hasn't even come in and met the patient. How does that work? How do you take records and do all of those things? And the rock star, our dentist, hasn't come in and sat down and say, "Good morning, Art. How are you? So happy you're
Yeah.
here today. I know you've met Jennifer, my assistant. You're in good hands with her. Let's start and chat a minute and then decide what's right for you today."
That's fantastic advice.
That's so simple. I mean, it's so simple, Art.
Well, it is simple. We're in a people business. This is not about money. We're in a people business. It's about caring and trust. And that's
Yes.
what you've taught. That's what I've taught for years and years. If you care about people and they trust you, they're going to go to the moon for you. If you
Yep.
tell them you need all 32 teeth replaced, most of them might say yes. It may take a little while, but yeah, I mean, it's all about that.
But to go back to the question, where the biggest mistake, we
Yeah.
just go back to that. So the opposite would be not meeting the patient, not introducing and connecting with your assistant, including her right from the beginning as your advocate. I mean, not embracing that moment and starting out with that great first impression and then shift. And if you skip that and then you go into an exam and you've got treatment and then looking at everything from A to Z, rolling it out on a piece of paper and presenting it all at once, I mean, you're in trouble right away.
Right.
In trouble.
Well, that's the Johnson & Johnson commercial. You never get a second chance to make a first impression, right?
Yeah. So that's the answer.
There you go. So how much of the treatment acceptance situation is clinical and how much is communication?
Probably 80% is communication, right? Because we're just saying that you have to connect. And again, every patient's different. And so you're having to try to ask a couple of questions and really listen to this patient and find out who they are to know when they're ready to hear what portion of the treatment or how much today. They will tell you. And it has nothing to do with their education or their profession, their wealth. It's really the belief they come with about where do they place value on dentistry in their life. And that comes from their history, their growing up. Maybe their medical condition plays a part of this too, that you can connect. So you really have to be focused. So the dentist can allow themselves time to pay attention to these elements to then know how they're going to approach this. And to test it, they can say, this is what I'm picking up from you, or this is what I'm starting to learn a little bit about. And so I think that today, it sounds to me like this, and this might be our best approach. What do you think? So to check in with you, and you could say, yeah, that sounds perfect. That's exactly what I was thinking. Or, well, I was expecting this today. And it's, of course, correct. So
Yeah.
if you're a good listener, I pay attention. I can say, well, I'm so glad I asked you that. Let's make a shift and take it down this road then.
Yeah. And it's about, I've actually watched Doctor now. Again, I'm not a dental consultant, but I know enough to be very dangerous.
Mm-hmm.
And I've watched doctors present treatment. I've just been stood in the operatory, kind of out of the way. And several times I hear them say that they start out the conversation, well, let me tell you about me. Let me tell you about my family. Let me tell you about my hobbies. And the patient is like, well, what about me? I'm here. That's why I'm here, right?
Right.
You've seen that, right?
Right. All the time. And, I watched a dentist last week, new associate. My favorite thing is, of course, being in an office and standing in the hall and watching all of this and seeing it. Instead of being told what they do, I like standing there and watching it. So I put my tennis shoes on and I stay in the corners and I watch because that's really where the magic is. And to see an associate walk in and stand there over the patient saying, hello, after, again, records were taken, so a little bit backwards, but just standing over the patient, just that simple step and that body language instead of sitting down where you have eye contact is off-putting.
Yes.
And one patient may be comfortable, but why take the chance? You just go in and sit down right away and look them in the eye and say hello. So simple.
It's not rocket science. I mean, it really isn't. So let's switch a little bit here. We're talking about treatment acceptance. I just recently interviewed on my podcast the president of the American Dental Hygienists Association. And it was a wonderful interview. And we're talking about the importance of the hygienists. So what role does the hygienist play in the growth of the office production?
One of my favorite topics.
Okay, well, let's go.
The dentist and the hygienist are partners. They have to attach, and too often they're separate. We're down the hall, we do cleanings, and over here we're doing the restorative dentistry. If they come together and collaborate, and a dentist includes the hygienist, for example, a quarterly meeting the dentist has with hygienists to discuss the clinical aspects of periodontal disease and clinical dentistry together with hygienists. Once a quarter, twice a year. But I have not been to one office where a dentist meets with their hygienists on clinical issues. And so you can't have an expectation that they're going to collaborate and work in each other's behalf as well. They do work together. I'm not saying that, but really, really connect even more if they don't come together and just talk. And certain cases are brought into that meeting. The hygienist maybe brings a couple, the dentist brings a couple, and they just talk about this person and the treatment and what their intentions are and they're hoping to do over time. And they just have a clinical discussion. So that hygienist feels empowered. She feels like she's part of the end result. In addition, when a case closes, when a large case ends and it comes toward the end, the dentist makes sure the hygienist is in the office that day, brings her into the room, and includes her in the closing remarks.
Yeah.
Because it was without her creating a healthy foundation that he could or she could not build a restorative case successfully.
Yep.
Right?
That's 100% true.
And I think we really have to pat these hygienists on the back and give them credit for that. Say it again and again. Show the team that's who they are, because the team can resent the hygienists because they don't know what they do. Maybe they're not quite sure. They feel like they don't participate or help when they should. All kinds of things may come about. But if they understand what they're there to do, because the dentist says so, and they really make a statement in their behalf, the team comes to respect what it is they're there for, and it builds the whole thing around the patient.
No, absolutely. And it's important that at the beginning of the relationship with the hygienist, Andrea, that the doctor explain to the hygienist what his or her treatment philosophy is, so that when the hygienist is talking to the patient, the hygienist is going to be able to say to the patient, well, I think that this is, this is his or her philosophy, and this is probably where we're going. And the hygienist tees the doctor up for a successful presentation, right?
100%. And 80% of restorative dentistry is coming from hygiene.
Yes.
Because patients come in new, they're at a little bit of an arm's length about who is this, what am I do, are they trying to sell me anything? So they don't necessarily accept everything in the beginning, but over time, with a good relationship, they build trust. And now that trust leads to treatment acceptance of a larger case later. Could be 2 years, 3 years, 5 years, 10 years. And the patients that day, the dentist goes in and says, Bob, I think it's time to get this and that done and really approach this. Sure, whatever you say, let's do it. So simple. But that was the collaboration between the dentist and the hygienist over all those years, how they built that together. So to really honor that, it's like you're banking all the dentistry that's diagnosed over in the hygiene department. It comes out at different intervals. That's why you can go easy with a new patient, because there is no pressure. You know where you're going to place them. You're going to let them decide when to do this, when they're ready. In the meantime, we want to keep them with us and keep them in our recare system, so that through the continuing care and the hygienist's education, relationship building, they're going to come around, and we've got this. I learned this, by the way, from Dr. Sherilyn Sheets. I learned that philosophy. I've learned everything I do from somebody, and that really stuck when I learned that Dr. Sheets really approached large cases with this patience and the time to take for an individual to come around to do this treatment when it was appropriate. And she put them in the educational department, which was hygiene, and extremely effective. And that's why the large cases, came in front of her.
She is a remarkable clinician. That's all we can say about Dr. Sherilyn. Yeah.
But the philosophy is what drives it, her and those that are successful.
If you could fix one system in a dental practice or most dental practices, what would it be?
Might be the comprehensive exam.
We're not going to get away from that, are we? Right? No,
because that's where it all starts, Art. I do not be repetitive, but it's where everything starts. Scheduling comes from that. The comprehensive exam / communication to create, while we're talking about the soft side of a comprehensive exam, the philosophy of that, it must have a system. There has to be a system behind that and everything. So that takes some work. And the system for a new patient exam and the specific details are unique to each practice because the dentist has a personality that must fit into the system. So we have to work around who is going to be the treatment coordinator that's going to bond with that dentist and their personality and all of these little tiny pieces. So to watch their personality, their style, because you're not going to really change someone, you're going to try to enhance it. So it's a system built for them, but it is a system that leads to everything else that's great after that. The numbers, all the financial side of it comes from the success of the comprehensive exam, the periodic exam too, any exams where there is treatment diagnosed.
Right. And again, folks, you've heard me on this podcast. We're coming up on over 7 years. A lot of what I learned about dental management, I learned from this nice lady on this podcast. I listened to you lecture. I listened to you with clients. And she is a wealth of knowledge. So please, doctors, I hope you're taking notes today. So take a second, Andrea, real quick, and talk a little bit about what you do. And if someone wanted to get a hold of you and maybe work with you, how that would work, and give out your contact information.
Everybody's unique for me, as I've mentioned, so I have to determine how I'll work with someone after I speak with them. So I have a client recently who's got just an incredible practice. I know his reputation from the past. He happened to call, had a couple of areas to address. I told him I could address this one area specifically, come in to just do that, or I could come in and do a full evaluation of the practice. And I gave him the particulars of doing both. He chose to do the full evaluation because he'd never had that done. At the conclusion of that, I came up with about 2 or 3 areas that he could work on. That may take 2 or 3 meetings. And unless he wants ongoing meetings to just touch on various areas, he's good to go. What I don't want to do is upset anything that's working. So I don't go into a practice and just because I'm going in say, okay, we have to change all of this because I'm the consultant. I really want to stare at what already works. Why is that successful? And I don't touch it. It may be very unconventional, something I haven't even seen before, but for them, it works. So I leave that alone. So that might be a project I do. Someone else, I've been with these other clients 15 years. I'll start out with 1 year of going every 6-8 weeks. And then I may go on a recall basis 2 to 4 times a year. That's all up to them. I don't work under a contract, so everything is wide open for design.
Yeah. And if someone wanted to get a hold of you, what's the best way to do that, Andrea?
I think the best way is to just email me, Andrea@ClasenConsulting.com, and just introduce themselves and ask me the question they may have, or if they want to set up a phone call. That's probably the best way. I don't travel anymore. I'm really working between Los Angeles and San Diego, and that's not considered travel to me when I used to go across country. So I'm kind of local. I'm kind of close to home. I don't have the energy, Art, to put together.
No, trust me, I get it. Although, you're just amazing with what you've done with a lot of the clients that we've worked together on. Let's switch gears a little bit and talk about internal marketing and case growth, Andrea. What is internal marketing in your mind, and why is it more powerful than external marketing?
Internal is the least expensive method to receive new patients and to get a word out, reputation and build all that. And it has the greatest yield. And it's everything you're doing inside that practice that is talked about positively when the patient leaves you. It's the experience and how the patient feels when they come and go for each visit. Again, these small things. And I can walk into an office. Of course, this is like a newer practice, something new. And I pay attention to this very closely. I can walk in the door and I can almost tell, not always, but many times I can tell what the culture is when I walk in.
Yes.
If it's a happy group, if they love their doctor, they would do anything for him or her. It just comes out because they've got a big smile. They're very happy about just sitting there versus very somber, very serious. Professional. It may be very professional, but no levity. Nothing that's just, they've got some freedom because the person they work for trusts them completely, knowing they're caring for the patient. So they're not under any pressure to be stiff, And so they give off this relaxed warmth. So it starts there. Internal marketing is about the people serving the people and really giving them this service, this attention to detail. Those individuals can't do that if they don't care about the doctor and the place they work. It's just not possible. You can't make someone do those things. So
No.
there's a long list of internal things. There's the send a thank you note to the referring patient. It's having amenities at the chair that make the patient comfortable. We have the comfort menu, which is a new fun thing that some offices have on an iPad, and the comfort menu is given to the patient and they can hit what they'd like during their visit, whether it's music, a blanket, protein drink.
I like
And
that
yeah,
comfort menu.
the comfort menu. And so it's a very nice addition, but it doesn't take the place of how that assistant is talking and giving attention to the patient. So if you add the comfort menu and you add these amenities, blankets and a lumbar pillow and all those things, it's just fabulous. But it won't work at all if you don't have the team engaged in caring first. On the other hand, you could take all those other amenities out and just have a caring team and you'd probably hit some high marks.
Oh, absolutely. I mean, people, they're already nervous about going to the
Mhm.
dentist in many cases, especially a new dentist that they don't know. And if they walk in and everybody is smiling and everybody is happy and everybody cares. Here's one I like. Tell me what you think about this one. New patient exam. Wouldn't it be really cool if the doctor says, "So, Art, I understand you have 2 boys, Nathan and Forrest. Tell me about them." I mean, when does that happen in a healthcare interview?
Yeah.
Those are the little things that you need to learn about. So here's one for you. How can we increase production in an office without adding new patients?
Tap into the unscheduled treatment.
Yep.
And as you know, I know this isn't anything new for you. We've got about $1 million unscheduled treatment in a 12-month period in most offices.
That report is available in Dentrex or EagleSoft or Open Dental. It's very easy.
And most don't look at it. Most do not know. When I go in and I pull that and show them, it's the first time they've seen it. And that same dentist is saying, I need new patients and I don't know why I'm not meeting my production goals, et cetera. So it really come down to, if we get more new patients in the door, we're just going to add them to the list. We're going to add them to the pile of unscheduled because we haven't figured out our system and our technique and our approach and how to connect with people in the very beginning well enough. So we're really just getting more in, looking at that as our focus, and then they just go on to the pile of unscheduled and nobody's looking at that. And I will say, I want to make this point, calling patients on this unscheduled list, like taking the list and giving it to the front desk, saying, let's call these people and get them back in.
No?
Not successful. The person at the front doesn't like doing it. We'll just start there.
And they say they don't have time.
Let's pretend they have all the time in the world. It's a dialing for dollars feeling. And
Right.
that's what the person that's calling feels. The person that didn't accept treatment wasn't motivated to do that treatment back when. They're not going to be motivated when someone calls them, because to them, it's going to sound like somebody wants to fill a spot in a book and make dollars. So their best bet is to make sure that the unscheduled treatment is on the route slip and is reviewed by the dentist for the hygiene exams the day before. The dentist looks at the unscheduled treatment on that route slip, highlights 1 or 2 areas only of unscheduled that would be done next, gives that to the hygienist in the huddle and says, why don't you talk to the patient about this when they come in? Let's see where they are, if there's been a change, and maybe we can engage them back into treatment from that. So one by one, periodic exam by periodic exam, we can bring them back in very slowly, but it's the dentist and the hygienist working on that, not at the front desk calling patients from a list.
That's great, great, great advice, Andrea. This episode is brought to you by Bank of America Practice Solutions. If you are thinking about starting or growing your dental practice, we would love to help you take the next step. Email us at dg.connect@bofa.com, and we will send you a free business plan template that is perfect for starting the conversation about your future practice. Bank of America Practice Solutions has the expertise, the resources, and the support for your success. Don't wait. Email dg.connect@bofa.com today. Hey, it's Art Wiederman here. You know I don't recommend products lightly. I only share solutions that can genuinely impact your practice's clinical outcomes and bottom line. That's why I really want to tell you about Interview. They've developed an FDA-cleared technology that measures internal tooth mobility, something that traditional methods just can't detect early enough. Here's what that means for your practice. You can identify cracks and loose restorations before they become emergencies. That means better treatment planning, fewer surprises for your patients, and more predictable case acceptance. Interview integrates right into your existing workflow. No complicated processes, just clever diagnostic information when you need it. If you've been looking for a way to elevate your diagnostic capabilities and strengthen patient trust, book a demo at interview.ai. That's INNERVIEW.ai. Mention my name and you'll get $250 off. That's Interview AI. INNERVIEW.ai. What are simple systems that dramatically increase practice growth? I know that you can probably tweak one or two things in a practice and shoot it to the moon sometimes.
Well, scheduling, we know scheduling. I'll say that appointment scheduling is straight off the bat, and I think every consultant has taught the techniques of scheduling, and it's known by most offices now. They may need to refresh the details, but to have some structure to a schedule and pre-block and all those aspects of a schedule that can hit a target, I'd suggest that the target be by procedure, not by dollars. Team members are not motivated by dollars. The person scheduling may need that number, so she has a parameter. But to speak about dollars each day, I found is not motivating. It's better to say, how many of each procedure do we want to do? So we can lay out our schedule to flow well and yet be productive. So there's that. The other system that really generates productivity is having structure and protocol for a periodic exam. Periodic exams are weak in most cases. Not that the doctor isn't doing a thorough exam, but the patient's not realizing it. They're going in and it feels too social. So the doctor with the hygienist having more of a checklist that they're going to review together over the patient on all the aspects of what's covered in that exam demonstrates to the patient there's value there. The blood pressure, medical history update, oral cancer screening, periodontal status. All of those things are said verbally over the patient, put out on a walkout statement as well. So a patient can see if I'm paying $90 to $120 for an exam, there was some value to it. By the way, this has become more important when dentists have gone off of PPOs. So if they've shifted from a PPO and they've gone straight fee for service, patients now paying full fee are really recognizing the fee for an exam where before maybe it was covered. So now they go to the front desk and the person at the front says that'll be $90 today or $280 for your whole visit. And they go, excuse me, the dentist just came in and said hello to me. You're charging me $90 for an exam? So we have to really create a value and make a statement there. In addition, it generates tremendous amount of restorative dentistry to be scheduled back in the schedule and production is improved.
Let me ask you a question, Andrea. I know that, and again, I talked about you being my big sister and your dear friend and my other big sister, Pam Strother. I don't remember which one of you taught me this, but you do the comprehensive exam with a new patient. And then I think you guys had told me, I don't know if this has changed, that you like to do another comprehensive exam. Is it every 2 years, every 3 years? How do you structure that?
I ask each dentist to do it by patient because if there's a patient that has not completed their dentistry and they're just really limping along barely, they really never did engage in the treatment to begin with. They're seeing the hygienist sporadically. They've got several issues, but they're still coming in and we're trying to keep them healthy. Maybe, and they're a smoker. They have a lot of health compromises, medical situation that's compromising to their overall health. Maybe 2 to 3 years for that patient. A patient that completed everything and did comprehensive treatment plan, a full mouth reconstruction, let's say, they're in the office every 3 months for a hygiene visit. Maybe 5 years is adequate. Or think of it as a one-size-fits-one. All marketing.
I like that one size fits one.
All marketing and all decisions. If I'm going to be a private fee-for-service practice, what is going to make me unique from a larger group corporate style practice? I'm going to take a one-size-fits-one approach. It's harder. You have to think a lot longer. You have to pay attention. You have to review records the day before. You really have to be zeroing in and focused. But a one-size-fits-one will hit the target more because it's going to be that dentist that walks in and says, "So, Art, how are your boys?" And last time you told me Nathan was really into this project artistically. What is happening there? I've just been anxious to ask you about that.
Yep.
Boom.
That's
Right?
huge. And it may be that not one word that you talk about clinically they'll remember, but they'll remember that.
That's what it
And that's what
takes.
they'll go home and that's what they'll tell their friends and their neighbor and their spouse and that oh my gosh, I've never been to a healthcare appointment where they know who my kids are and they're asking about his art project. I mean,
Yeah.
that's huge. I'd love to spend like a day talking to you, but we don't have that time. I want to hit a couple more things before we call it a
Sure.
podcast. What separates an average practice from an extraordinary one?
The leadership of the dentist, their leadership and communication style, how they revere their staff, and I mean genuinely, that they have a high respect for them. That does not mean they give them all that they want. They acquiesce to every demand. They run a loose ship here. It doesn't mean any of that. It really means they stand on principle. They can substantiate what that principle is about, why they do it. They're very attentive to their needs. I have a dentist I work with who is exceptional in this area. And I just always remember this one story. I was in the office one day, and the person at the front said, as he was passing by the front desk, she said, "Doctor, we've been having difficulty with the copy machine over the last couple of weeks. We're really struggling, and it's hit and miss." And he said, "Well, that's unacceptable for you. Order a new copy machine today. That's all I need to hear." And he
Right.
walked away and said,
Yep.
"Thank you for telling me that. I want you to have everything you need to get your job done." Boom. I mean, you can't put a price on that because what he has done is saying you are more important than anything to bring the focus to our patient and care about them. You are the most important piece. For you to have what you need to get a job done is what I'm going to make happen. So there may be several things to discuss around that. I'm not suggesting that a dentist walk through and say, buy this, buy that. That's not my point. It was the attentiveness and the importance of what that meant to give it attention and to make it a priority. So something as simple as that, something as simple as walking in and saying good morning to each person personally, saying goodbye before you go out the back door, checking in with them in the morning huddle. Is everybody okay today? Is everybody on point? Anybody off kilter? We won't discuss it now, but we'll cover for you if you need help. Just those gestures just empowers the team and that team soars. Now, what they do is what the dentist gives them in this gift, they give to patients. It's reciprocal, 100% reciprocal. By the same token, if a dentist is neglectful of a team in some way or disrespectful, whatever we may call it, they now are indifferent to patients.
Yep.
Indifferent. So they get their job done. We can't really put a finger on it like, should we let them go or something? And it's not really like that. But they're just there because they get their check. Maybe they like the people they work with. They work close to home, but there's no passion and loyalty toward the practice of the dentist. That's created by the dentist. And
Y-
that is where you walk in the door and you could feel it. I've always said it's like a great sitcom. When a great sitcom like Friends or something is a big hit, it's the magic they have between them. It's that
Yes.
synergy. You
Yes.
create that in a dental office, there's no stopping you.
That right there, notwithstanding all the other great things you've said in the last hour or so, that right there, I think, is the whole key to the whole thing, is just creating a situation where everybody is patient-centered and everybody is acting in the best interest of the practice. And the money will come, doctors. Please listen to this. This is really important.
100%.
The money will come. You may see a $20,000 case. But if that patient isn't ready for that case and you try and shove it down their throat, bye-bye patient and
Yeah.
bye-bye 10 of their friends who would have been patients,
Yeah.
right? Yeah. So 2 more things I got time to cover with you today. Andrea, what advice would you give to a new dentist starting a practice today? Now, this takes your going back to, well, I didn't realize that you were an assistant back in the year you said you were in. And so in all the time you've been in dentistry, I'm assuming that this advice has changed. But what would today, 2026, what advice would you give to a new dentist?
Don't change anything. right? I mean,
Hasn't
because
that so
okay,
it
so
hasn't changed.
let's just say the practice that the dentist buys has some problems. It maybe the systems aren't great. It could use some help. It could use a little tweaking. But the patients that come there, that's the expectation they have. Whatever it is that's going on there, patients walk in and that's the expectation. So if decor is dated, what the patients don't want is change, at least not right away. And so I think the new dentist should stop and get to know, why do the patients come there? Like, even if you're scratching your head, like, I can't believe this or that because I could do it this way and it'd be so much more up to date and better. Yeah, you'll get to that. You'll get to that. But first, find out how the patients are made to feel. What is happening for them when they come in? You can do that by talking to each individual team member, get to know them, have lunch with them, say, what is it about this practice that makes it special? Why do patients love the doctor? Why do they love coming here? What is it that you do that makes it extra special for them? Really immerse yourself. It's kind of like what I do. Immerse yourself into the practice to see what is really going on. Then decide from there the timing of a change, what change might be best done that's less obvious to a patient, but would be internally a good improvement. Take it slow. Try to keep the team if you can. But to keep the team, you got to get to know them. Otherwise, they could resent you. And now you've got a battle against people in the office that can do you in.
Oh, yeah, absolutely. And what do you think about this? Whenever I mean, I ran a CPA firm, Andrea, for 33 years, and you knew some of my people, and I had, 3 people that worked for me for over 30 years. One of them became my long-term partner, Pam Chamberlain. And I never made a major decision in my practice without consulting with at least my brain trust of my top 3, and if not the entire team, and say, guys, I'm thinking about doing this. I'm thinking about changing this software. I'm thinking about putting in this new
Yep.
system or offering this new service. What do you think? How do you feel about engaging the team in while the doctor is still the leader and the doctor still makes the final decision? What do you think about engaging the team in making decisions?
Critical. You just have to remember what your focus is. The focus is to hold that intact for what was wonderful or valuable there. And there is something. If you bought a practice, I mean, assuming there's something there that the center that's worthwhile to learn about. So the team helped create that. So you have to definitely incorporate them and listen and have this humility about you to say, I don't have all the answers. I do have goals and I have aspirations for this practice and my future. I want to take you with me on that journey. But let's start with my getting to know you and where we're starting, because I really do respect that first.
Let's switch gears here, Andrea. What about a 55-year-old doctor who just feels burnt out and dreads coming into the office every day? What advice do we have for that doctor?
The majority of time, I have found that the reason is staffing and management. In fact, that's the reason they'll sell to a DSO, actually, is that the headache of running this business, managing staff, hiring, finding and hiring, and all of that, they're exhausted. They're doing the dentistry, trying to run the practice, and they've just run out of gas. So if you can really, in a consulting format, really talk about, let's pinpoint what it is that's created the burnout. Because I've had the call with the doctor saying straight up, I have this issue with staff. If you can't help me fix it, I'm selling. That happened to
Wow.
me within the last 6 months. Exactly those words. If you can't help me fix it, because that particular dentist is able to quit, retire if he chooses to. Still loves dentistry, not worth it though if he's got to deal with the headaches of infighting. So when you really find out what it is that's caused the burnout, and it's usually been a slow burn over a period of time, and you could say, do you have enough energy to try to tackle it? And let's see if we can fix it, rework it. And then, because if you still love dentistry and you're not ready to go, maybe there's another chance here to go forward. So most cases that something works out that's beneficial for them to continue. And maybe it's just another year or two. It doesn't mean it's, a long period of time, but it's really a shame that somebody leaves with burnout or leaves a practice unhappy, tired, worn out, discouraged, disillusioned about dentistry. I want to leave like I feel right now, just loving it, as much as I ever did. I'd
Yes.
like that for the people I work with.
One of the things too, Andrea, that we didn't really talk about when you and I got started in the profession was mental health. And we did a whole podcast, Andrea, with Dr. Eric Johnson, who's in San Clemente. And our wonderful Orange County Dental Society here does a wellness seminar every year. And it's well attended. And that is a big deal. So, doctors, if you are having issues, neither Andrea Clasen nor Art Wiederman are mental health professionals, but there are people out there that can help you. Your dental societies have resources for you, and that is really important.
I didn't know about that, Art. That's amazing.
Yeah, I can connect you certainly with Shaylin Roberts at Orange County Dental Society. They have a wonderful, wonderful program, but it's a big deal. The ADA is addressing it and stuff. Let's leave on this, Andrea. Let's wrap up your 45 years in coaching, maybe 60 years in dentistry. What has dentistry taught you about people?
Not to be judgmental, be more compassionate, understand, because I've taken so many communication courses, months and months and months. I've just studied communication since I started. And through that, I've come to realize that what I've said throughout the podcast is that everyone is unique and different. They come with their beliefs, respect their beliefs. And am I able to do that by listening and not being judgmental of that, just accepting it and working with it? Every dentist is that way, every patient that they see, every team member. So I think I've just become a better person from meeting all these wonderful people and finding a unique way to help them for who they are.
Yeah. And you've worked with so many wonderful people.
Mhm.
I'm going to mention one name, and I think you know who I'm going to mention is we had Andrea and I both had a long-term client, Dr. Victor Feld in Irvine. And Dr. Feld incorporated everything that you've talked about. Very sadly lost Victor, too soon. And he was just the absolute encapsulament of a leader and everything, wasn't he?
Absolutely. 100%.
We loved them both and stuff.
We
So,
sure did.
Andrea, one more time, what is your email if someone wants to get a hold of you? And then please stay with me as we take out the podcast.
My email is Andrea@ClasenConsulting.com, and it's CLASEN. I think the main thing is just to spell Clasen correctly.
Yep.
But to ask me any questions or connect with me, that's probably the best way.
Let me say this. I don't know if I've ever properly thanked you. I'm not going to thank you in front of thousands of people. What you've done to help me in my career, I can't measure because you and Pam taught me a lot about the only thing I knew about being a dental CPA when I came in at the age of 25 was I knew how to get to my dentist's office and when my appointment was. That's about all I knew. But all the pride stuff and when we all got together at our meetings and everything that we did together and just the absolute class that you show every day of your life and working in this profession is just a gift. And I thank you for taking the
Well,
time for talking to me today. It's just it's a joy. It's an
it's been
absolute
a
joy.
treat for me, Art. Thank you for
Well,
inviting me.
Oh, absolutely. So stay with me as I take out the podcast. Everyone, again, I want to thank my wonderful sponsors, Bank of America Practice Solutions, the Academy of Dental CPAs, this is the official podcast of the Academy of Dental CPAs, and Interview, which was invented by Dr. Sherilyn Sheets, who Andrea spoke about in the podcast. And please be sure to follow us on social media, on Facebook and Instagram and YouTube and TikTok. And I promise I won't be dancing on TikTok. I promise I won't. You don't want to see that. That's a bad thing. And then please come and see me in Las Vegas at Caesar's Palace on June 26th. I'm doing a whole day program on transitions. So with that, Andrea Clasen, thank you so much for coming on and sharing your wealth of knowledge with our listeners. That is it for this edition of the Art of Dental Finance and Management podcast with Art Wiederman, CPA. Please subscribe, please tell your friends, and we will see you next time. Bye-bye.